Hi everyone, my name is Akhil Chandakar, and I'm an undergraduate emergency medicine research associate here at UCI. I'm going to be talking to you guys about primary care visit frequency and non-urgent ED visits. So ED overcrowding is a complex and multifactorial problem. It's been linked to poor patient outcomes, increased healthcare costs, staff burden, and just a lower quality of care. And according to current literature, a main contributor to ED overcrowding is non-urgent ED visits. And while improved PCP access has been linked to reduced ED utilization, the relationship between how often patients actually go and see their PCP and their use of the ED is still not very well understood. So our study aims to investigate the determinants of PCP visit frequency and barriers to PCP access among ED patients at a large level 1 trauma center. So our study took place at the UC Irvine Emergency Department and included 964 patients. Basically, ED staff assigned each patient an ESI score, stands for Emergency Severity Index. It ranges from 1 through 5, and for our study, we define non-urgent as 4 or higher. Undergraduate researchers administered a survey which asked patients a variety of questions to assess their healthcare seeking behavior. And so we found that 63% of respondents visited their PCP fewer than 3 times per year. And we wanted to explore further, so we ran some more chi-square tests and some regression models, which I'll show you guys. So our main takeaway, our finding, is that patients who saw their PCP 3 or more times per year were 35% less likely to visit the ED for a non-urgent issue. And that's compared to those who had fewer than 3 visits annually. This association held true even adjusting for factors like sex, race, age, insurance type, and chronic illness. And this reinforces what current literature suggests, that frequent PCP visits help manage chronic conditions and offer preventative care, which reduces the need for emergency services when they truly aren't urgent. But we found an interesting finding, specifically looking at insurance. We found that Medicaid recipients had 55% higher odds of visiting their PCP 3 or more times per year, yet also had 70% higher odds of a non-urgent ED visit, and that's compared to those with private insurance. And this finding does challenge a common assumption. You would think regular engagement with PCP automatically reduces ED use. But the data show that it doesn't fully apply to Medicaid patients. And it's important to remember, Medicaid patients are not a monolith. They represent a variety of patients with different medical and social vulnerabilities. And actually, this paradox has been echoed in other studies, like the 2024 Journal of Community Medicine found that Medicaid patients were among the most frequent ED users, often citing long wait times and a limited appointment availability in outpatient settings. So what does this mean? Well, it tells us that insurance coverage doesn't guarantee timely care. And while coverage is important, it's not the full solution. Provider shortages, scheduling delays, and lack of after-hour cares can push even insured patients to seek care in the ED. So we looked at some of the barriers to PCP access, and no shocker, limited appointment availability and wait time, as well as job responsibilities were one of the leading barriers to PCP access. And we're actually exploring right now analysis on how the perceived convenience of the ED compares to those with the PCP. So to close, I just want to highlight a few key takeaways, limitations, and future directions from our study. So first, we saw that patients who saw their PCP more frequently were significantly less likely to visit the ED for non-urgent conditions. We also saw that Medicaid patients, despite higher rates of PCP visits, were still more likely to use the ED for non-urgent issues. Our study has some limitations because its PCP visit frequency is self-reported. There is a risk of recall bias. And since our data is cross-sectional, we can't make any causal conclusions. We also recognize that certain racial and ethnic groups were very underrepresented, like Black patients who made up just 5% of our sample. And so where do we go from here? Well, one promising direction is expanding the use of patient navigation programs. These have been shown to improve PCP follow-up attendance by 52% and reduce repeat ED visits by 32% according to current literature. And considering that in our sample, 92% of patients in our study said that they actually trust their PCP, and like I said earlier, 63% visited less than 3 times a year, programs like these can help bridge the gap between trust and access, helping our patients stay connected to care and reducing ED overdose. So ultimately, our findings reinforce that access to primary care is necessary but not sufficient. Coordinated care, better appointment availability, and patient education must all go hand in hand if we truly want to reduce non-urgent ED reliance. Thank you. you so much. This is just wanted to thank the Emergency Medicine Research Associates Program for collecting all the data for our study, and then Dr. BC, Dr. Taylor Lucas for their support, and the UCI School of Medicine Prime Lead ABC program for all their support as well. Thank you so much.